gentlemen, welcome to another episode of You're on the Mic with Synx, and I'm your host, Synx, aka your favorite new author. Today, we have a brand new guest, a magnificent pleasure to have us, a guy that sits before us today. Let me introduce the song. I can't even get the whole church thing together, but anyway, ladies and gentlemen,
Oh my God.
Angelica Queen Nanu Scott. She's a nurse, wife, business owner, mental health consultant, and forgive me, my mother-in-law, if you're listening. No. And most importantly, she's my wife and my queen. Ladies and gentlemen, Angelica Scott.
Hello.
How you doing today?
You're a clown.
Hey,
You're a clown.
They know I'm a clown by now.
A clown. I can't take you serious.
Why not?
This shouldn't be a video. It should be just a conversation. No video. Need it.
People want to see though.
Post me then. Don't you have to video pictures?
They want to see it all. They want to see the interview live.
Really?
Yes.
Okay. Let's get started then.
Let's get started. So, right off the bat, I want to introduce you as the RN of the podcast, our medical consultant. She is what Dr. Oz is to the Breakfast Club, to the You're on the Mic Synx podcast show. So today, people want to know what's going on with COVID-19.
What's going on with COVID-19? Same shit, different day.
What you mean?
It's COVID. It's a virus. It's airborne. It's droplet, which means that it's in the air. It can stay in the air for hours. Please, it's not a game. But I mean, what else you want to know about COVID? I mean, it's a big virus that's going around, that's scaring everybody.
What do you see in the hospitals, seeing that you're working on?
I guess the best question is, what don't I see in the hospital? I
Well,
think.
in that case, what don't you see?
I don't see many people really recover. You're gonna have. I guess when I say recover, I mean you're never fully yourself as you were before. You're going back to the ability to breathe on your own. You may be able to breathe, but you're gonna have scarring on your lungs, your heart, all those vital organs. I guess you say most of the people end up going home if they make it out of ICU. Critical care, y'all. Critical care. If they make it out, they're going home on oxygen. I had my maybe first few months into COVID, I had my first patient come on my floor that was downgraded from ICU to a regular COVID floor to a regular floor on my end, where he was unable to walk or anything without at least 3 liters of oxygen. When your regular nasal cannula that you use when you give people oxygen. But he went home on that. That was him.
So
That came about because he was at work making a living, and there was an outbreak in one of the chicken plants.
So the oxygen is basically his new life now.
I can't say it would be his new life. It was his then life. I don't know what happens after he goes home. I don't know if he ever came off the oxygen or if they had to keep it on him and he just weaned off or what, but that day was like crazy. Like,
Wow.
we ran out of oxygen tanks for home health because we have like a supplier down in the hospital, and we had to wait for his oxygen to literally get delivered from Chesapeake before he could leave Newport News to go home to the Eastern Shore.
Wow.
Yeah, so it's real. It's real. I don't care what anybody says that's one of those anti-vax people or whatever. saying it's not real. It's
You're
definitely real.
Stupid if you don't think this is real.
Yeah, it's definitely
And
real.
if you one of my followers and you one of those people that's saying it ain't real and this offends you, I'm sorry. You can unfollow. But yeah, at this point, everybody knows somebody that's been affected by this. And if you still not a believer,
Even if you
don't wanna
haven't,
believe.
honestly, even if you haven't been or know anybody that's been physically affected by COVID, we all have been affected by COVID. Like, just your everyday job, like grocery workers, nurses, doctors, everybody in the hospital, respiratory therapists. Big up to my respiratory therapists. Like, they the G's. Like, they the people that's staring COVID in the face right now. Y'all thinking the doctors and the nurses and everybody, y'all need to be thanking these respiratory therapists and these housekeepers. Give big up to them, whoever you know, because those are the people that are in the face of COVID. Like,
shout out to the housekeepers.
Yeah, my housekeepers, they do it. They do that thing. They go in there, they clean those COVID rooms after somebody has died, after somebody has been transferred off of another unit because they became positive. Like, those are the people that you really need to thank. Like, yeah, I'm a nurse, but I'm more protected half the time than those people going in to clean it, because I don't have to stay in that room after that patient has been in there for hours and try to clean that room, and then they try to clean it so fast. I was told the other day about a housekeeper, they got 40 minutes to clean a room. Can you imagine that? Like, all the stuff you gotta wipe down in a hospital room in 40 minutes.
Wow. So what type of precautions can we take? I mean, I know they say wash your hands and don't touch your face. I mean, you got anything else that us people need to know that maybe we just don't think about other than the obvious?
No, wash your hands. But I'm gonna tell you one of my pet peeves, and one of my homegirls at work, like my nursing friends, all of us, we get so pissed the fuck off when we see these people out here wearing gloves. Man, if you gonna wear gloves, you gonna have to keep changing them janks. Like, really, one pair of gloves doesn't make any sense to go through a grocery store, because everything you touch has germs on it, and you're gonna just keep transferring the germs, just everywhere. It's called cross-contamination, people. So if you're out here wearing these gloves, you need to take them off and change them out. Imagine one trip to the grocery store, you're gonna need a whole box of gloves. Like, it's crazy. It's so crazy. I get so upset and annoyed in the grocery store when I see them people.
I witnessed this firsthand. She really do get upset. Like, I gotta stop her from going over there to saying stuff to random people.
Like, it's nasty. Think about it. Do you ever see a nurse or a doctor come in the room, do care with a patient with their gloves on, and then walk out the room, go to the next room with gloves on? No. You see us take our gloves off and you throw them away. You've even seen me, maybe not me, because some of my people, you know, not probably watching this, but you see us, we clean the patient. If I'm about to give them their meds and that or wipe their butt, I'm changing my gloves. Like, that's just, come on, y'all. It should be common sense, but my mama always told me common sense ain't so common.
True.
But yeah. So, again, wash your hands, sanitize your hands. I guess according to the CDC now, if you do wear gloves, you can wash your gloves. You can sanitize your gloves. Sanitize them up to 6 times, you can wash them up to 10. If you want to do that nasty stuff, then you do it. But I'm just saying, to each his own. But wash your hands, keep 6 feet apart, wear your mask. And if you don't have to go anywhere, people, please stay home, because obviously America, we just slow. I just don't see how all these other countries were able to get this under control, and we over here still fighting it.
I got rights.
Basically. Y'all should hear us joking on people.
I got rights.
It's ridiculous.
Ain't nobody gonna tell me to put on no mask.
We're gonna cut it out. Cut it out. I told you you were a clown, dog. Next, I'm over COVID, yo.
No. Next big question, though. All serious.
Oh, Lord.
You know what it is. To vaccinate or not vaccinate.
I ain't vaccinating shit in my family right now. Not even my damn dog.
Damn. She just got a heartwarming shot a couple months ago.
She won't no COVID shot. But nah, honestly though, for real, if you want to get vaccinated, that's on you. But Angelica, the rest of the Scott family, we not doing that. We got too much we don't know about this vaccine. It came out too fast. It just reminds me, it gives me anxiety, y'all, about the Tuskegee experiment with syphilis and all that stuff. Like, that just give me those type of vibes. So, I mean, if you want to do it, I'm not going to stop talking to you, but that's on you.
Not to mention, I've seen Resident Evil, played Resident Evil, I Am Legend, all of that. I'm good.
Right.
I can wait for it to wait. I mean, I'm going to just wear my mask because I ain't got rights.
Stupid. And you don't go to where after 7.
Yeah, right. And I definitely don't be going nowhere I don't need to be going. If
So,
it ain't on the essential list, I ain't going. Mine is, we'll talk about that later. But anyway.
But yeah, so I mean, vaccine, cool. You want it, get it. If not, oh well, jingle bell. It is what it is. I'm not getting it. I mean, everybody I know so far at work that has gotten it has not had any symptoms that we know of. No, I guess current symptoms. I don't know what their long-term symptoms might be or whatever, but at this time, nobody has experienced a real, like, symptom that I know of.
You can go first. I'll let you go first. I'll catch up on later on in the year.
But there's phases. It probably won't come to a lot of people until the 4th phase. Like, right now, it's just really this first phase where it's really just the first line people in the hospital.
Damn it, I'll get mine 2023.
Yeah, I mean, it is what it is, but yeah. Next, okay. I'm over COVID.
She's over COVID. You heard it when the Queen speaks. We gotta move. So I introduced you as the nurse. You're RN. You recently got your BSN to go along with that. You have a bachelor's in mental health. You've been a social worker / case manager worker. I consider them the same things, even though they are technically not the same thing, but I have yet to be shown what the fucking difference was. But anyway.
I don't have a social work degree.
But you were doing social worker shit. Once again, I do not know what the difference is, and no one has been able to prove to me what the difference is. Other than one needs a license and the other don't, but the person without the license still does everything. But anyway.
Yeah, don't even get your pressure up, man.
We're gonna talk about this nurse life. So you are considered still what they call a brand new nurse.
Am I?
No. But to older nurses, you're considered a brand new nurse.
Am I?
Anyway, my question is, so how do you maintain a healthy work / family balance? Because I know with the field you're in and the way your job is set up, like nursing demands a lot from you. And I also know you are a family person and you love family. You love being around your husband, your children. Your child. Well, you do have children. You can't. We're not gonna discount Donna like that, the 4-legged child. She loves you more than me, and I'm sick of this shit because every dog we get tends to love mama more than daddy. But anyway, how do you balance that?
I'm jealous, but okay.
Just a little bit.
How do I balance work and family time? I just do it. Like, there's no
Nike.
There's no, I guess, real answer to that. It's a woman's nature to just be nurturing, to be that go-getter, to be that person that can hold the family together and still do what she needs to do. It's just, I don't know. That's a great question. Because on the inside, I feel like I be doing a horrible job as a mom and a wife because I work so much. Just saying. But, I mean.
But let's be real. You only work 3 days out the week for real. I mean, under certain conditions.
But do I? I work at the hospital 3.
Yeah.
We about to skip out, so people are not going to know what's going on first.
We'll come back to that.
Right.
Yeah, okay, so balance.
So how I balance hospital life. There we go. Hospital life and family life. I do that based off of where I chose to work. That was one of the reasons I chose the hospital that I am employed at. Because it gives me time in the morning to interact with my family, But then on that drive, that 35, 40-minute drive, I can get my mind together to be able to go in there and not think about my family life, or if we, whatever's going on, the chaos of our schedules. And then on the way home, it gives me time to debrief and calm myself down, or let whatever go from the workday before I step foot into the house. Because Lord knows, I don't know what I would do if I wasn't available to y'all, because y'all my heart. Like, I grind hard because y'all my booze. Like, that reminds me of like the Grinch when his heart grew.
Wow.
I'm not calling you a Grinch. I'm just saying, it just made me think about the movie when his heart grew 5 times larger. I don't think you're a Grinch today, at least.
Anyway. So, as a nurse, what do you say would be the biggest struggle is for nurses?
I got a top 2. My top 2 would be the emotion that comes with patient care. I have a lot of patients that I have like really built a bond with due to how long they stay with us at the hospital. I mean, you would think nobody wants to go to the hospital. Nobody wants to stay in the hospital. Mm-hmm. But there are some people there that are there for a good little while because of just different things that's going on. It could be insurance. It could be they have behaviors, or their diagnosis doesn't meet a certain criteria for rehabs or placements or somewhere, and they're just stuck because we can't put them out there. But they become part of our everyday. Like, we go in there and we call them by their first name. Like, they become family. Like, especially the ones that don't have family. God knows we band together and we buy them personal hygiene stuff, because everybody know that my hospital shit ain't worth shit for real. That deodorant ain't really deodorant. I think it's like water sometimes, man. But we actually like buy them personal hygiene stuff, like toiletries, and we bought some of our patients like clothes and things of that nature, just so they can feel a little better with being in the hospital. Don't have to wear that stupid green gown all the time, So that's my top thing. My other thing that's a struggle with being a nurse is the verbal abuse that we get. People can be very, very rude to nurses. Mm-hmm. People think that we just sit around and we just always at the computer or whatever. And you may see us sitting down, but that might have been our first time sitting down since our shift started. There are times where I can walk in and immediately clock in, get report on my patients at 7 o'clock and be moving until literally 3 o'clock. Never sit down. Don't pee, don't eat, don't drink, there's a lot of things that we don't get to do that people don't see. Just because we're not in your room per se does not mean that we're not working. So I've been called some names before. Ain't nobody called me no nigga though, so they good for that. I've been called a bitch a few times. I've been called ain't shit. I've been called a ninny baby. I've been called a little.
And this is why I cannot work in the same location as my wife. Even if for some reason one day I decide to go into the nursing field, which I don't think I'll do.
Nah.
But we cannot work in the same location because I've been called a charge and I would lose all my good federal benefits I have as a federal employee.
And we need those.
And we need those. And I really don't want a record, but I don't mind getting a record from my family. That goes for my wife, my daughter, my dog, in-laws, all of that. My family, I will kill you slowly.
Don't show the people that sad. Come back. Come back.
I'm going back.
Come back. Look at my face.
Gerard Butler, all bodies and citizens, I will fucking kill you.
You're not coming back.
I'm back.
But yeah, so that's probably the two hardest parts or heartstringers as a nurse. It's very tiresome. For those of you that don't know, you didn't even tell me where I work, like what I do.
Well, I was gonna let you do that. Back.
You gotta say the actual place.
My wife works at a prominent. I was searching for the correct word. A prominent, well-established hospital in the Hampton Roads area. She works on the neuro floor, where she deals with victims of stroke, back injuries. The floor also operates as a med-surg floor, which means they see every fucking thing.
There you go. Listen.
I know a lot of nursing terms, and I shouldn't know it as a person who is not in the nursing field. So if you want to learn or study for your NCLEX text, and just let me know. I'm a wonderful tutor, even though I have not taken the test myself. But I know it's on the test, and I guarantee I'll pass.
So you gonna just take you just gonna take credit for that? Really? All right. You got
can
it.
Reach me through my contact information below in the box if you need help studying. I'm charging though. Ain't nothing free at this point in life. I gotta make a living.
Wow.
Now back to my wife.
You summed up well. You forgot to do cranies. Like I get people with cranies.
I didn't want to say that because I didn't want to get it mixed up. You know, sometimes I stumble over my words, and I was supposed to be saying cranies, and I would have said trainees, and then we would have been in trouble.
Gotcha. Right. So yeah, so I work on a neuroscience floor, and my main thing I work with is strokes. We work with seizures. We work with MS. I've had people with Parkinson's, ALS.
Y'all remember that ice bucket challenge?
Yep. What else? We do lumbar, any type of spinal surgery, starting from the neck on down, honey. We do it. Brain tumors, so we got to do cranies. We do a lot of things, but it's been a very interesting year since I've been at the hospital and been practicing as a nurse. I've seen people die. I've done my first round of CPR. Like, it's been real. But yeah, my floor is definitely an interesting floor to work on. Very busy. Enough about nursing. What you want to talk about next?
Oh, I was just going to ask, simple question. So would you prefer the hospital or the doctor's office?
Hospital. Why?
Why?
Flexibility.
Okay.
And pay. You get paid more to be in the hospital than you do in the doctor's office.
And when you get paid, I get paid. Ching, ching, ching.
Word. You're crazy. But yeah, speaking of that, I know that because the people are like, how do you know that? My own doctor, I asked him if he was hiring, and he told me that I didn't want to work in his office because nurses in the office only make probably about $20 an hour. And I was like, oh yeah, I'm well above that, buddy. So a hospital setting is better. You do 3 12s. 3 12-hour shifts, if y'all knew what that meant, but yeah.
Okay. Now, this next topic, of course, I asked permission before I hopped into it. It's dealing with anxiety and mental health and everything like that, and I wanted to make sure I had the okay to bring about it because everybody don't know what we struggle with or what somebody is struggling with, so you don't ever want to put them on blast or anything like that. But in this case, you did give me permission to ask about it, and I kind of wanted to bring it up because I know it's a lot of people out there suffering in silence and not sure what to do or feel like something's wrong with them or anything. But I wanted to ask you about anxiety and mental health and like what type of advice and you can give and like what type of struggles, if you don't mind sharing, like you've dealt with that could possibly help someone else that's struggling and that's afraid to reach out for help. Because I know as Black people, we always tend to downplay mental health and we push it into the side, or our family members and other people who surround themselves around us are like, ain't nothing wrong with you, you just deal with it. You can't afford to have mental health. Pray, talk to Jesus. And yes, we should be praying and talking to Jesus, but sometimes we need a little bit more. And as the Black community, I know we suffer from not dealing with mental health.
Okay, yeah. I do suffer from anxiety. Like, I haven't been fully diagnosed with anxiety, but I know what anxiety is. I know the signs of anxiety. I've seen it. I've studied it. I've gone to therapy myself, and I didn't go to therapy for my anxiety. Started with therapy because of grief. And then it just turned out that I just knew what anxiety felt like. My anxiety is more so the inner thoughts that I have. I get very nervous about a lot of things. I think the worst. I think the worst of some things, of some situations. I always think the worst. And in my mind, I try to play it as that I'm trying to prepare myself for the worst in the event that it does happen, so I don't get stressed out. But I'm trying to, I guess, put it into words, what I really go through with my anxiety. Because on the outside, a lot of people think that I'm a very strong person on the outside, or a very resilient person, which I can come off as that, but a lot of the time my inner thoughts be getting me. I'm always oh, this is gonna go wrong, or this is gonna happen, or I get flustered, and when my anxiety goes up, I feel myself getting mean. I feel like I get snappy with people. It comes off as a really mean sarcasm that I've noticed in the past few months. But again, I feel like everybody should, if you're feeling any type of anxiety, any uneasy feeling, because some people might not even realize that it is anxiety. A lot of people think that anxiety, you are always in a corner trembling, or you're crying, or you're skittish about things. Anxiety can come about where it changes your mood in general, and just, you can be angry, you can be sad, you can just have a flat effect. Anxiety is just different for everybody, and I suggest that if you have uneasy feelings that don't go away after a while, it's okay to go talk to somebody. Even if it's just a friend, just to see a different point of view of things. Again, I do have a therapist. I have not been to my therapist in a while because I felt like I didn't need her then. But in the past few weeks, especially since COVID is still here, it's going on a year since COVID's been around. So I see that it's possibly going to be me calling her up and just being yo, I just need to talk to you. Something like that. Just to ease my mind because of the things that we have seen, we have seen, people in the hospital have seen. I think that's where a lot of my anxiety comes from. Am I going to bring home COVID to my family because I don't know somebody has it? So I cry a lot. I can feel uneasy, and I know my anxiety is high when I feel like I have to cry, and I can't pinpoint why I want to cry or why something made me cry, because I just don't be knowing. A few weeks ago, I had a lot going on, and I was trying to finish school, and it just felt like I got to the end of the road for school, and something as simple as leaving my paperwork for school at home just made me just go off. I just started yelling and screaming on the phone with my mom and just crying, snotting everywhere, because I just felt like it was just another stump in the road of something that's going on with my life. But I was able to get it together and get my life together, get my papers and all that good stuff. But definitely don't be afraid to reach out to help, or to help others. I'm gonna say it could be a to help, because you never know when your family members, your friends, your co-workers, whoever they're going, what they're going through, and as their friend or whatever you are to the special person, you can just be literally a shoulder or a listening ear, honestly, with that situation. I mean, I don't know everybody's situation, but yeah, go get help. Go get help.
Go get help, y'all. And a lot of people do not know. I believe somebody is at the front door. But 1 second, y'all. Hey, we record the podcast! I'm back, everybody. But yeah. I was going to say a lot of people do not know that I am in the mental health field as well right now. I'm a psychology technician at the Hampton VA Medical Center. I'm also currently working on my license for counseling. It's a very slow process for me, and truth be told, the ball has not fully started rolling yet. I mean, it's been nudged, but it ain't rolling. But yeah, mental health in the Black community is very important. I really want everybody, if you feel like you need help, reach out. There's so many, what's the word I'm looking for? Is so many resources out there now. You don't even have to go to a therapist in person now. They got apps where you can literally meet a therapist online. So yeah, reach out, look for your resources, Google, get help if you need it. Don't suffer in silence. But on from that to some happier topics real quick.
Of course.
The final topic for the evening, as y'all may know, as I said already, my wife is also a business owner. She is the owner of Scott's Consulting Agency, and boy, oh boy, I love this place, man. This place has kept the lights on, if you know what I mean. Hey, Lily!
Hey.
I know that's unprofessional, but hey, y'all love me for who I am. So tell us about Scott's Consulting Agency. I wanted to call her Bay so bad right there at the end.
You could have called me Bay.
Alright.
Scott's Consulting Agency. That's my baby. That's my baby. As previously stated, I used to be a case manager for a local community services board, and I was there for almost 5 years. Worked there full-time, went to school full-time, wife full-time, pregnant, and I got kind of tired towards the end of nursing school, trying to work a full-time job and being a new mom and everything, and still technically being a newlywed because we hadn't been married for 5 years yet. And I just woke up one day and was like, yo, babe, I'm gonna get my own business. And he was like, what? And I was like, yeah, I want my own business. I was like, look, check it out. I got so many people out here in the community that I'm cool with through my job that I can do the same thing that I'm doing at my job for them, but I can make my own rates and get paid how I want to get paid and work how I want to work. He was like, all right, go for it. And he was like, write it out, pray on it, go for it. So I hit up my homegirl, and she helps people get LLC. She does taxes. My mom is calling me, y'all. Oh, sorry, so I keep looking at my watch. But she helped me get my LLC. I told her what I wanted to do. She helped me do that. I started to market myself when I would go out and, look at some of the providers as a case manager. I would go out and be like, they lacking here. They lacking.
Slacking.
So on my off time, I would hit them up and be like, yo, like, I'm thinking about starting my own business. Like, this is what I'm going to do. And they were like, all right, word, Angelica, we could sit down or whatever. We could talk or whatever on the weekend and everything. So make a long story short, it just came about. One of my providers, program director, was leaving. And she told him what I had planned to do. And he just basically was like, I'll give you a chance. So I started doing that. And then I just started marketing myself on Indeed and just telling other providers about what I plan to do. And it wasn't nothing but the grace of God that I had got so many contracts. Like, I was getting so many contracts with people that I literally had to turn people away and tell them, like, look, I'm spreading myself too thin. Like, I'll try to get you somewhere else, or I can do a PRN for you or something, but I can't do you full time because you got a lot going on. And I already got my first people, like the people that really put their heart into me. But so I still do that. I still work with group homes and day support. So if you know anybody in the IDDD field that just needs some help, even if it's just with regulations and keeping up with certain things, like, I can help them with that for a small fee, of course. and everything. But now I'm starting to really enjoy and grow as a nurse. So I have been blessed. I mean, to have people come to me with home health agencies and say, hey, look, Angelica, like, I need you on my team. Like, I know you from previous, your previous job and everything. And now that you're a nurse, it was like, I just got to have you on my team. So right now I have started to expand myself to home health agencies to be basically like their medical case manager. How would I put it? I just basically call them, talk to the clients, make sure that they're happy with the services, and make sure they're.
I can't even get it out. Fuck. Keep going. Leave me.
Okay, leave. Okay, where just making sure that they're happy, they're satisfied with services, and that their aides are doing what they're supposed to do. Because
fucking the thermometer in their butt. There you go. I got it out. Woo!
A thermometer in their butt. Really? A rectal temp? That's what we're talking about. But yeah, so that's basically what Scott's Consulting is. I don't have a website. I don't have anything. So y'all can always, if you got questions or want to get in contact with me about it.
I will link her email below. I will not pass out the phone number because if y'all motherfuckers act funny, aka men, as I said earlier, I will kill.
Bro.
I will kill.
Come back. You're not focused. Hey. You're so petty.
Blood in my eyes.
You're petty. You're petty.
I'm back.
But yeah, so if you want to contact me, email is below, or you can contact my husband.
I'll put her Facebook information up.
My Facebook?
I lied. I didn't put that there.
No, I'm good. Back to what we were saying. Then I also am career-wise. Let's get back. Your mother-in-law keep calling me. We gotta do this.
Whoa.
So yeah. So as like I said, I'm expanding myself as a nurse, and I've also been talking to somebody about helping them with one of their ventures. They want to open up their own nonprofit and basically want a nurse on their board. So I've been presented that opportunity, and I'm thinking it's gonna probably be a go for that shit, yeah, for real. But I'm gonna keep, thinking on it and seeing what I can get done. Just resume builders and things of that nature. I have to always build myself so I can be great for my babies. You and Leilani.
And
of course, Diamond. But yeah, anything else? Like, what's going on? Like, what's good?
Hey, for real, shawty, I mean, that's about it. That's all I had, you know what I'm saying? I ain't want to hold you too long, you know what I'm saying? Your mom's calling and want to speak with you and everything, so I'm going to go ahead and let you rock out, you know what I'm saying? This is my 2000. This how you should talk back in the 2000s.
When I didn't like him. Let's not get started on that.
Hey, she love you, boy.
I did not like him then.
She love you.
Don't let him play y'all.
Yeah.
Did not like him. He didn't like me either. I don't even know why he frying.
She want to look at me right now.
I'm looking at you. That's not how you were in high school.
She right. I was definitely not in high school. I was the silent killer in high school. I was the hitman of the crew. Like, I just stood there and everybody knew who I was, but they was like, oh, he cool as shit, but yeah, he don't talk that much. But
I told him he looked like he would be an active shooter.
I mean, she put me straight in that other category. I ain't in the colonizer category. I wasn't on that level. I was.
It was scary to me.
I was what Tata is to Jay-Z, if y'all know what that means. The straight shooter. Shut up.
You're crazy.
All right, y'all. We gonna get ready to get up out.
You gonna invite me back to your show?
Almost definitely. I told you the Dr. Oz of the show. You gonna be up here a lot.
I ain't talking about as no nurse. I'm talking about like.
Oh yeah, we definitely got this couples podcast thing coming soon. We gonna an episode. I ain't gonna say thing because y'all think it's a new show, but we got a couples
It might
episode
be a new
coming.
show.
I ain't got the time. I'm already spread thin. We got a lot of projects coming 2021. Sync Productions. Check us out. Link below. Oh, by the way, make sure you subscribe if you're checking us out on YouTube.
Somewhere down below, somewhere on the screen.
I haven't figured out how to do all the tricky shit with the YouTube videos yet. I'm learning. We growing. But check us out on YouTube. Check us out on whatever your podcast preference is. We on Spotify. We on Apple. We on Google. We on Amazon Music. We on a bunch of other shit that they signed me up for that I didn't even sign up for. So just look for You're on the Mic.
You put your baby girl on your show?
Of course. I gotta let Tink do a show.
She gonna sing her ABCs.
I'm gonna let my baby sing her ABCs. But we're gonna go ahead and get out of here, y'all. Everybody, peace.
Deuce.
Peace.
Deuces.
We're not finna do this. Bye, y'all.
See you later.
All right, good show. Good shit, man.